Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hey everybody, it's Jessa. Welcome back to another episode of the Better Sex Podcast. So glad you're tuned in today and sharing the time with me. You know, a podcast is a one-way conversation. I mean, I have a conversation with the guest, of course, but then this is delivered to you and you just get to listen to it. But have you ever felt like you've got questions, about this episode or any other, questions about sex in general, questions about relationships, or if you just wanted to have a little bit of interaction with me? There is a way to do that. I hold monthly webinars. They're basically Q&A sessions, ask me anything, once a month for everybody that's on my mailing list. So I want to invite you to join me on that. You can find it at bettersexpodcast.com/list. And join the list. You'll get the webinar links that let you join in and have this open conversation. And I would really love to have you participate. You will get roughly weekly emails with hopefully valuable insight and tips and the link to the latest episode of the show every week too. But I definitely try not to overwhelm you with the stuff in your inbox, but I'd love to have you be part of the community. Today's episode is about chronic illness and sex. I'll probably have a series of these episodes more specifically with people that are suffering a specific chronic illness, and we'll get a little bit more detailed into what different illnesses present. But today my guest is Dr. Lee Phillips, and he is a clinical social worker and a sex therapist in DC and Virginia, and he is writing a book called Sex and Love When You're Sick. Because there really isn't something out there talking to couples about navigating the emotional and physical challenges of somebody having a chronic illness and all that that can mean. He's going to talk about the sort of mental health and emotional aspects of, impacts of that kind of diagnosis. And of course, the sexual effects that happen when somebody's chronically ill. And then especially how couples can find hope and inspiration and creativity in their life moving forward. This does not need to be a huge dark cloud over the rest of your relationship and your sex life. So my guest today, Dr. Lee Phillips, I hope you love it. Lee, thank you so much for being with me today.
Thank you. Thanks for having me.
Could you start by just talking a little bit about who you are and what inspired you to write the book and why you're the person to write it?
Well, I'm Dr. Lee Phillips, and I'm a licensed clinical social worker in Washington, D.C., Maryland, and Virginia. And I've worked in several mental health and substance abuse treatment settings, including outpatient, community mental health, inpatient treatment, and private practice for the past 12 years. I'm also a speaker, and I've lectured on the topics of preventative services, anxiety and stress management, caregiving stress, depression in the elderly, mindfulness and cognitive strategies for chronic pain, and ethical decision-making, as well as assessment and mental disorders. I have published in the Journal of Bachelorette Social Work, conducting a research study on LGBTQ affirmative teaching at historically Black colleges and universities, understanding program director views. I'm a sex therapist, and I'm also an adjunct professor with the School of Social Work at Western New Mexico University in their online MSW program. So what really inspired me to write this book? I've been treating chronic pain and chronic illness for about 12 years as a psychotherapist. And I started a chronic pain management group in Williamsburg, Virginia, which is the area that I'm from, Hampton Roads, Virginia. And I got a job as a geriatric psychotherapist. And so they wanted me to treat chronic pain. So I was having a lot of clients that were coming in 65 and older that had several chronic illnesses. They had chronic pain issues due to chronic illness, But then I started to see in a shift, I started having people that were 18 years old to 45 that were coming in with different types of autoimmune diseases, neurological problems, and other chronic health conditions. And they started talking about having like a low desire and arousal for sex.
Right.
And I said, well, that's kind of interesting. And so then I moved to DC because I wanted to be in a city. And I went to a Grow in Your Private Practice workshop. And the woman, Gail Gutman, who hosted that workshop, was interested. And what I did, and I told her that I had a specialty in treating chronic illness and chronic pain. And she said, have you ever thought about becoming a sex therapist? Because a lot of people have sexuality issues based around that. And I said, no, but I think I will. And that's kind of how this started. So I started seeing more people coming into my office with sexual dysfunction that had chronic illness and chronic pain. They were couples and also individuals. And so I started blogging about the topic, and I started having some followers on my blog. And I said, well, you know what? I think I want to write a book about this, because I think when you specialize in something and you have a passion for something in our field that we do as therapists, I think it's important to write about it and to talk about it.
Yeah.
So that's where the passion came from for the book.
Okay, so that's interesting that the sex therapy came second. Like you had the chronic illness and chronic pain exposure first, and then realized, wait, there are all these sexual needs. So I'll go ahead and get the training and certification as a sex therapist, and then put those all together.
Yes, that's really where it came from. And, as I'm continuing on this sex therapy path, there's a lot of different types of literature out there. I'll go into the bookstores in DC, and there are some books on sexuality, but there's really not a lot of books on chronic pain. There's been a few books written by people themselves who have experienced chronic illness and chronic pain, but we're not seeing quite a link to chronic illness and sexuality. There was a book written in 1988, and then there was another book written in 2007, which is The Ultimate Guide to Sex and Disability, which is an amazing book.
Yeah.
I wanted to take something further. And so I'm kind of taking that research and carrying it a little further, where I can write a book for couples that are in heterosexual relationships, gay relationships, transgender, kinky, and polyamory relationships. So that's where the book will be geared for, with that type of audience.
Okay. So what would you say, if one member of a couple or both have some sort of a chronic illness, how does this show up in their sex life? What are the common, presentations or the common complaints or struggles that people have?
Well, there's two different types of spectrum. I think, on this spectrum, I think there are couples that can have great sex, and sometimes the relationship can kind of fix itself. But then there's also couples that have a lot of emotional discord or this disconnect, and it's helping them become emotionally connected again so they can have sex. So what I have found is there's one ill partner and there's one healthy partner. Okay. And there's this rupture that tends to happen in the relationship. So there's this isolation, and there's a lot of fear that, they're not going to be able to function sexually. There may be a partner who's ill who had the high sexual desire in the partnership, and all of a sudden they've lost that. Yeah. And so there's this state of shock. There's always a crisis phase that usually happens when there's an onset of a chronic illness. So the book will benefit people who are experiencing that. But, there's a lot of changes. They can be physical, such as changes in their body, side effect from medication, fatigue, and pain. So they may have a lot of sexual side effects or dysfunction from medications, from just pain and fatigue. So I see quite a bit of that. So it's helping them just become emotionally connected again, too, because there's this isolation.
Right. And you talked about sort of a crisis phase, but I'm also thinking that with chronic illness, it might creep in really slowly. It might be a crisis the day they get the diagnosis, but I'm imagining people are experiencing shifts and changes, and they don't know yet.
Right.
You know what I mean?
Yes.
Like there's this very, very gradual slide into.
There is a gradual slide. Actress Selma Blair, she was diagnosed with multiple sclerosis back in October of 2018. And when she got the diagnosis, she was shocked. And there was of course, that was a crisis, but she was also thinking to herself, well, gosh, I know what it is now, because she'd been having symptoms prior.
Right.
So sometimes they are having symptoms. They're not sure what it is. So a lot of times the anxiety and the fear and the depression can be starting at that point, and then we
Yeah.
can start to see a disconnect in the partnership.
Right. Right. Okay. So you've got the physical effects. You've got this maybe lack of desire, pain, depression, these various things going on. And then I guess what you're saying is that starts to divide the couple potentially, right? There starts
Yes.
to be a disconnect.
Yes, there can be a disconnect in the couple. There can be fear that they're not going to be able to do the things that they used to be able to do in the past. They can't please their partner like they were able to do. The ill partner may have a fear that their partner is going to leave them. That's always something that comes up in session.
Yeah.
And what can I do to keep my partnership? I've even had some couples that will open their partnership because, or their relationship because one partner feels that I can't please you like the way that I could in the past. Why don't you go off and do that? And I've seen that happen, but I've also seen that partner, the healthy partner, say, okay, but I just want you. And I think when they can start working together as a team instead of opponents when it comes to the illness, that's where we start to see healing. And that's what the book is going to talk about. There's going to be the book is designed like an arc. So we talk about the problem, and then it's going to go into what a couple can do to heal emotionally and then sexually. So it's looking at what's possible instead of what was once achievable in the partnership.
Yeah. Yeah. I mean, it sort of reminds me of the stages of grief, right, that Wharton wrote about where, first there's this mourning and this crisis and fear, all those different things that come up. And eventually, hopefully you get to what's our new normal. I mean, there's sort of no going backwards. So it's what can we do with what we've got?
Right. And that's actually a chapter in the book, The New Normal of the Partnership, on how they connect emotionally and how they connect sexually. What's also interesting is that, with a life restricted by illness, sex can be amazing. It can be the one thing where partners can be close together. So there's that too, where there is that pleasure and that intimacy piece when there's other things that someone cannot really do when they are ill, that takes away from recreational activities, social activities. That's where a lot of the depression tends to set in as well. I think with a chronic illness, there's just so much uncertainty.
Yeah.
You wake up one day and you may feel fine and you may feel like you can go and do things that you used to love. And then you wake up the next day and you can't even get out of the bed.
Right. Right.
So the book is really about hope and giving people and couples hope because there's just not a lot of literature out there on sexuality and chronic illness.
Yeah. So what are some of the other effects or symptoms that people have? I mean, you mentioned chronic pain, but what else can happen with various kinds of chronic illness? Like, I don't know if you've got sort of a list of examples of the kinds of things people struggle with and how those might show up.
Well, a lot of it will show up through their mental health. There is this isolation that starts to happen. So we do see quite a bit of the depression that tends to come in with illness. So that's the main thing that I usually see is that they're not able to really do the things that they used to be able to do. So there is that ability to engage in occupational, social, recreational activities that can certainly be limited, and the negative impact on their sex life can be devastating. So, sexuality in a relationship has a wide mix of feelings and emotions. And when both individual and their partner are together battling disease, the future of their intimate lives, it just becomes uncertain. So we see this big fear. Those are the things that I start to see more than anything. One of the things, too, is helping them navigate the healthcare system.
Oh, okay.
Which doctors do we go to? It's really hard to get an answer. Sometimes doctors don't know what the diagnosis is, especially something like fibromyalgia, and they can't figure out what it is. It's like, okay, well, you have fibro. Well, what does that mean?
Yeah.
And what does that mean to my sexuality? And so I have clients that come in and they're very frustrated with that because their doctor has not explained to them, not all doctors, but some, they have not explained to them what's going to happen. So the first two chapters in the book are the physiological changes that happen with the body with chronic illness, talking a little bit about the brain. And then the second chapter talks about the psychological factors, so the emotional piece
that
comes with it. So those are the two things that I really see that come into my office. There's the physical illness, and then there's the mental health piece that comes with it.
Right. Which it seems to me part of that would be transitory, or, like as they're adjusting to the diagnosis, and then other stuff might be more long lasting, the depression and the isolation and the fear and,
Right. So we talk about those in session 2 when the couple first comes in, or just the individual that's coming in
right.
With chronic illness. So I see a lot of individuals and I see a lot of couples. And when I see the couples, of course, it's taking that sexual history and what was their sex like prior to an illness, and trying to really help them connect to get back to that. That's a big piece of it. And what can they do differently?
Right.
That's the biggest piece that I usually find that when they come in, because they're just so hopeless.
Right. So on the physical side of it, I mean, they may or may not have chronic pain. What other kinds of impacts do people get from these chronic illnesses? I mean, I'm imagining there's sexual dysfunction, or there may be restrictions if they've got a heart condition or something like that on what they're allowed to do.
Right. So there's different restrictions that people may have. So you may have to get creative with sex, which is what I help them do, you know, because I think in our culture, we're always taught that, it's about penetration and about having an orgasm. And that's not always the case. Emily Nagoski, she says, pleasure is the measure. And that's that's what it's about. It's about just what works for the couple.
Yeah.
And that's the most important piece. Is it mutual masturbation? Is it oral sex that they can do? Do they have to have penetrative sex? Because one of the things that really happens is there may be erectile dysfunction, especially due to heart disease and also diabetes. There may be an issue with, dryness with the vagina. That also happens with women that have diabetes. So we look at different alternative ways. And I think that's really what's exciting about sex therapy is that, hey, we try this. And if this doesn't work, hey, we can go over here and we can try this. So it's getting creative with your clients.
Right. And trying to help them understand that sex is not A leads to B leads to C, like this very narrow band of what's right. Like, let's make the room bigger and more options. And all of a sudden we can put this together in different ways.
Exactly. That's exactly what I do in session with my clients when they come in, with a chronic illness or chronic pain caused by a chronic illness. Because a lot of times, with the illness, they may not be in pain. They may become more in pain later.
Yeah.
Or I may have clients that come in with, pre-surgery pain and post-surgery pain, people that come in just with chronic back pain. So they have to do different things in the bedroom, right? They may have to do a different type of position. They may have to get more creative with the pillows on the bed. So we even talk about those things.
Right.
And really, what do they need from each other? Having that dialogue between both of them.
Yeah. Hey, this is Jess. I'm just taking a quick break, and I want to make sure you know about the guide I wrote about how to talk to your partner about sexual concerns. This comes up a lot in my practice. People have struggles, and it takes them so long to bring it up with their partner. They're afraid that that conversation is going to go badly. Their partner's going to be upset. The partner's going to be defensive, or they just don't know how to talk about sex and sexual problems. Common problem. So I wrote this guide that really helps you address this. It helps you prepare for the conversation, how to introduce the conversation, and then tips about how to actually get through the conversation so that you can change things with your partner as a team. If you are interested in this guide, you can find it at bettersexpodcast.com/guide. Again, bettersexpodcast.com/guide. Happy to send it to you. So it sounds like you, I mean, maybe I'm putting words in your mouth, but it sounds a little bit like we need to attend to their emotional connection. And there's sort of emotional adjustment to the illness, and whatever grieving process they're going to have. Like that comes first, maybe before we're going to get creative and problem solve the physical aspects of sex. Does that?
That's right. Okay. That's how the book is designed. There's the one chapter in the book that actually talks about the fear and anger. And that's kind of working on the emotional connection. And then around chapter 8, I go into the sex. And so it's looking at that emotional connection first, because there is such a loss when they usually come in,
Right.
especially if it's a couple, if they've been together for quite some time and then all of a sudden they're finally, they get diagnosed with a chronic illness, and there is that crisis phase that does happen.
Right. Right. So what do you recommend for people in terms of getting reconnected emotionally or making that transition? They're dealing with all the stressors, like you said, of getting the right diagnosis in the first place, and then the information they need in the treatment. And, it seems to me the chronic illness could totally take over their life, first of all, with all the bandwidth. So how do you work with people to reconnect and make some space for their relationship in this process?
Well, one of the things is it's having them in this session come into a safe holding space where they can talk with a third party, and communicate their needs to their partner and have them communicate their needs back. One of the things that I use a lot of is the Imago dialogue from Imago relationship therapy.
Would you go over that just a little bit, because the listeners may or may not know what that is?
So, the premise of, Imago theory is that we unconsciously pick our partners based on the positive and negative characteristics of our caretakers. And what it says is that, we have these childhood wounds, and our partner, they help heal those childhood wounds. They can hurt us, but they can also help heal us. And one of the ways on getting connected to each other is that, Harville Hendricks, he says there is this unconscious partnership, and then we have our conscious partnership. So one of the things that I use in therapy, especially if there's high conflict or there is this isolation and depression piece, is doing the Imago dialogue to where they can mirror each other. And basically what that entails is that there is a sender and a receiver. So, the sender can send a message and the receiver will mirror back exactly what they say. And the reason why we do that in the session is because the partner feels heard and they're present with each other. Because when I do a lot of couples therapy, I find that a lot of times when couples are talking to each other, they're already thinking about how they're going to react.
Well, yeah. I mean, I think that's, I think it's a human tendency, whether it's a couple relationship or not, right?
Or not.
We're building our response or our debate point or,
Yeah, we're always doing that. We're always thinking about how am I going to react because you're coming to me, you're starting to talk to me. And so I find that really does help set the tone, because they're able to share their feelings around the, based on the illness and what they can do to work through the illness to connect better. And then, of course, they have to validate each other. And I think sometimes that can be really difficult because, if they're upset at each other or there's this anger, I don't want to validate you. I don't want to have to do that. And so in this type of therapy, they have to. And I think that can really help. And then also empathizing with their partner. So I find Imago to be very helpful in helping them connect more. And that's going to be in the book as well, introduced in the chapter on helping them heal emotional wounds.
Okay. I'm imagining that, when I'm thinking about my own work with couples, that it would be important for them to schedule time together too, right? To make some decisions and commitments around investing in their relationship, separate from the chronic illness, right? Like
absolutely.
They're going to build connection. They need some opportunity to do that.
They do. And so, yes, we find that helps during the session, but it's doing the work outside of the session. It's having them carve out that time to make some time to sit and talk. And I recommend that they do mirror as they do that.
Yeah.
And I think that's been very helpful in my work, just in couple sex therapy, but also just with if they are coming in with a chronic pain or a chronic illness issue.
Yeah.
And I find that when they can start to be somewhat on the same page with each other on how they're handling the illness, that will open up the door to intimacy and kind of reconnecting where they were at prior to it. And that's where that point comes back into, what we do that's just possible here.
Right. So what's your recommendation usually, or your thoughts about people coming in and working as a couple if there's chronic illness, and they're just adjusting to that versus, how often do you think somebody should be in individual therapy, dealing with the depression and isolation that they might be feeling, or both equally important?
Well, there's one area in the book where I'm going to be talking about the healthy partner and how they can take care of themselves and how it's important to watch out with the whole caregiving aspect. I think that becomes a huge factor in this. So it's like, are you my partner? Are you my caregiver? So I think it's really critical for each partner to check in with each other. For, the partner who does not have an illness, watch for depression in them and keep an eye on their health as well. Because it can be quite exhausting. And the goal here is to be a lover, not a caregiver, but we can find at times that the partner may take on this role. And so they may want to seek individual therapy for their own self-care. And I always recommend that.
Okay, so it seems like an important point. Like there's an investment in the couple relationship, and yet it might be even more important to make sure both people are getting individual support and have some individual pursuits. So so you're not in that caregiving role and the illness doesn't take over your whole life.
Right. And what else I think is important, Jessa, is that they acknowledge their loss and build a relationship with the illness. So it's not so much of your illness, it is our illness.
Yeah.
Yeah. Because, in a partnership, there's this idea where there has to be that autonomy, but then we also need that closeness, and we have that relationship in the middle. Hey, and we can grow a beautiful garden in there, or we can or we can make it into something else. So I think
right.
The individual therapy piece is a great point, because it can be exhausting and it takes a toll on the healthy partner as well. And
I'm also imagining that support groups could be useful for each person. If you're struggling with an illness, to be talking to other people with that illness or similar concerns, and then the healthy partner might also really benefit from a support group of people who are in that role, right?
Yes. And I have referred people to support groups. I facilitate a chronic pain management group at the group practice that I'm with that has been great for people, just because that support is so needed. And I have several different people in that group that are single, but they're also in partnerships, and they have different illnesses. And some of them have the same illnesses, so they can talk about that. A common one that I always see is fibromyalgia.
Yeah.
That's a very common illness, and it's such a mystery too. Again, it's this illness where you may wake up and you can get things done. So one of the things I talk about is called pacing for pain, where you actually complete a few tasks, then you take a break, and then complete a few more. But what I find that happens is people will wake up, they feel great, and so they act like Superman because they're usually in pain, but they're not one day. So they get all of these things done, and then the next day they can't get out of bed.
Right. Yeah. I have a client in my practice who's dealing with a chronic illness, and she refers to it as the spoon theory, that you get a certain number of spoons, and it's less than somebody that's healthy. And you have to evaluate how many do you have today and how are you going to use them wisely. I think it relates to your pacing issue. Like, to be really mindful of that. If you're down to your last spoon, you got to be really, really careful with your resources.
Right. And that's why they call each other spoonies.
So it's not just her language. She learned that somewhere.
You do. There's all types of, there's some great groups on Instagram, Spoonie Sisterhood and Chronically Ill followers. And I've been able to tap into there a little bit and give some support to many people. And there's a lot of people who are really looking forward to the book. I think it will give just people a voice that they can be healthy, that they can have a sex life, that they can have something to be proud of in their life,
So let's talk about the sexual part of this. I mean, how people might have pain, they might have sexual dysfunction, they probably have lower desire, or less access to their sexual desire. So what are the steps, or what are your tips around overcoming some of this stuff and building a really thriving sex life with your partner?
Well, I think it's important that people that have a chronic illness, that they are in a partnership, that they do see a sex therapist. I think, bless you. I think that can be quite helpful because, as sex therapists, we talk about, well, what can we do in this moment? So it's helping them get reconnected again through touch. I think sensate focus is great to use with this population because they may not be able to do some of the same sexual activities, such as penetration, prior to getting an illness. So doing, touching, experimenting, talking about different themes they can use together. Maybe they can come up with a new erotic theme If you're working with a kinky couple, maybe they have not been able to do some of the things that they were to do in the past. So helping them get reconnected with that again, that I find can be very helpful. I think it goes to just really also sexual empathy and sexual communication. Mm-hmm. I think when you have empathy for your partner, you're going to find that it's going to be easier to communicate your sexual needs. I always find that communication, it's one of the easiest things to do, but it's also very difficult.
Yeah, I was going to say, I don't find it so easy. I mean, I guess we can learn it, but I think we assume it's supposed to be easy, and it really isn't, especially about sex.
Yeah, you're right. We really do. We assume that it's easy, and it can be extremely uncomfortable, especially when you're communicating with your partner on what turns you on and what turns you off. So I think having that holding space for them to be able to share that, I think really helps. And that can really help with, their sexual intimacy and also sexual adjusting. It's going back to the idea that they can't do some of the same positions. They can't do some of the other things that turn them on prior to an illness. So it's getting reconnected with something. So that's really what I work on with them, and then talk to each other about that.
Right. So where can people, I think we keep referring to the book without naming it, and I know it's not, done yet, but where can people find out more about you, about the book, and maybe some of these resources that you're talking about, whether it's books or groups or,
Yes, well, definitely my website, which is www.drleephillips.com. That's where my blogs are at. I blog about the topic all the time, at least once a week. And then also on Instagram at Dr. Lee Phillips. I do microblogs on there. And then if anyone wants to email me and ask me a question, they certainly can.
Okay.
At drleephillips@gmail.com. And there's a lot of different resources out there. The Sex and the Disability book in 2007 was an amazing book. There are a few articles out there too on the topic that I have found to be very helpful in terms of looking at different diagnoses of different chronic conditions. Yeah, my blogs, I have those resources in there as well. So that can be very helpful.
Okay, great. And I'll stick some of these in the show notes too, so people can find them easily, as well as a link to your blog. So.
Yes, absolutely.
Great. Well, thank you so much for taking the time to talk to me today.
You're so welcome.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get-to-know-you and question-and-answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.